Let's talk about a different type of government involvement in people's health care. We have New York Senator Kirsten Gillibrand, now joining a growing list of Democrats who are co-sponsoring Vermont Senator Bernie Sanders' Medicare for All bill. Sanders is expected to unveil the measure tomorrow. Secretary Price, does this have any chance of ever passing?
Well, I would hope not, and I think that the vast majority of the American people would hope not. And it's not because we don't think folks ought to have health care. We do. It's important, though, that health care be patient-centered and not government-centered. The problem with a single-payer system is that the individual, the entity making the decisions about what kind of health care you receive or whether you receive health care is the federal government. And I would hope that individuals wouldn't sense that that's the direction that we need to go. The direction we need to go in, as I suspect most of your listeners believe, is in the direction of patient-centered care, where patients and families and doctors are the ones making medical decisions, not Washington, D.C.
I can play devil's advocate, though, because seniors who are on Medicare, for the most part, like Medicare, and it's single payer. The problem is that nowadays people are taking out more in terms than what they paid in, and you have, according to the government, Medicare is going to go broke in 12 years. There's roughly a $50 trillion hole in Medicare. That's the problem. But if people like it, that's how the Democrats are going to be selling it. It's like, oh, we're just going to take a little bit of money out of your paycheck every month, and we're going to handle your health care for you. That's the sales game.
No, you're absolutely right. But the problem is that, as you noted, there are some challenges in Medicare. Again, all of us want everybody to have health care and health coverage. But in Medicare, there are 1 out of 8 physicians in this nation who ought to be seeing Medicare patients who don't because of the rules and the regulations through Medicare. There are narrowing of networks, so individuals, if you're a new senior, even in metropolitan areas right now, if you turn 65 and the doctor that you had doesn't take Medicare, and you try to find a new physician taking new Medicare patients, it's almost impossible to do so. And it's not because they've forgotten how to care for people. It's because the system itself bogs them down and makes it so it's much more difficult for them to care for folks. So the alternative isn't just government and isn't just insurance companies. It's a direction that we believe is most appropriate. The president believes most appropriate. And that's where patients and families and doctors are in charge of their health care and their health coverage.
Mr. Secretary, you guys got to do something about fixing Obamacare, and now it seems like the ball has been handed off to tax reform. What's the time frame that you're looking at? Because there's certainly movement in Congress to try and still advance something on repeal and replace.
Well, it takes an act of Congress to move us in the right direction on health care, and sadly we haven't seen that act of Congress yet. So what we continue to challenge folks to do in the House and the Senate, the House passed a bill. Senate needs to pay attention and make sure that they're able to pass a bill as well. It doesn't look promising in the near term, but what our challenge is, what our job is, our mission is at Health and Human Services is to make certain that every American has access to the kind of coverage that they want. And so what we're trying to do is to make certain that we relieve the burden of individuals from Obamacare, that we allow for states to have greater flexibility. Those are the kinds of principles that we believe in, that the president believes in, that will actually improve the health care system. But repeal and replace is an absolute necessity because we're moving in the wrong direction. Prices are going up, deductibles are going up, care is going down. Many individuals have an insurance card, but they don't have care because they can't afford the deductible that insurance card requires of them. So the status quo right now is not good, and it's a complete direct result of the previous system of Obamacare and the Affordable Care Act.
Secretary Price, good to see you. Tom
Thanks,
Price,
Megan.
Secretary of Health and Human Services. Take care.